wonder what it's like to be at South Shore as a patient or even as a staff. For some people, they haven't even heard of us, so they may also wonder, what is South Shore Women's and Children's Hospital? If you would like to find out, come with me and hear from our various departments who we are, what we do, and what to expect when you come here.
The first thing to expect when you come to South Shore is a serene and beautiful environment. We try to make sure that it is like a home away from home while providing you with exceptional medical care.
You can expect that you'll be treated in an environment that is safe, that is clean, that is secure, and a friendly environment.
We believe that patients have the right to high-quality care in a safe environment.
We have people working around the clock to make sure that everywhere is kept clean at all times. So it's a very clean, very secure, and very serene environment for patients. And when they come in, they feel like it's almost like they're at home.
We pride ourselves as being one of the safest facilities for women and children to receive medical care, and we deliver superior clinical outcomes.
We try to make the environment very friendly and acceptable to people who come in to receive care.
On the day of your appointment, you'll receive a call to remind you of your appointment and to make sure you're coming in for that appointment. On arrival for your appointment, we welcome you and we make sure you're as comfortable as possible and try to make your appointment as seamless and as stress-free as possible.
Once you come to South Shore, the customer care invites you into the building, takes you to the reception. The nurses take you from there. They do your vitals. Once your vitals is done, the experience starts from there.
We recognize the worth of every individual that walks into our facility and treat them with utmost dignity.
With respect to the quality of care we offer, right from when you come into South Shore, we have set policies and guidelines that guide our practice, and we try to make our practice as uniform as possible.
Every South Shore staff is very professional. When the patient comes into our facility, what they're greeted with is warmth and empathy, because we understand that this is a hospital and people want to know that they will be taken good care of. So we try to exude this.
We are compassionate. We meet compassionate nurses that care for you in an empathetic manner. We understand that for patients that are hospitalized, they cannot provide care for themselves as they should or as they would do if they are in their normal state of health.
Our team consists of professionals who have been well trained in South Shore's culture of excellence, efficiency and empathy to ensure that every patient receives safe, seamless care within a warm and friendly environment.
My experience at South Shore was top-notch. It met my expectation beyond. South Shore, they have a plan. And it's not as if you are in a place and nobody would attend to you or whatever. There's a plan every minute, every second. There's a doctor and a nurse that is coming to attend to you. That I really, really loved about them.
We ensure that we train our nurses to deviate away from the traditional idea people have about Nigerian nurses as being not as passionate or empathic to their patient. So we are very strong on changing that narrative in the Nigerian space.
We're very passionate about providing an excellent service, and we want everybody that comes into South Shore Women's and Children's Hospital to receive nothing but the best.
We have a wide range of treatment options, including non-invasive and minimally invasive procedures, and we've conducted over 1,000 endoscopy surgeries in the last 6 years.
From the beginning, we knew what we wanted in terms of our vision. Our vision was to create a facility that almost equitable to any women's and children hospital in the world.
The day I walked into the hospital for my surgery, 3rd of March 2020, I just came with the whole confidence, because I was sure that I am in the right place. These people knew what they were doing. And when I came, I saw that, everything was laid down already. And that sort of gave me rest. The rest I had during that 4 days of admission, it was fantastic. I was not scared, nothing. I just came like, oh, do what you can do and let me be free of this fibroid. And that was actually what happened. My post-surgery experience, my healing was the best. Like my recovery was the best.
My experience with South Shore, it was really nice. I was treated well. During my surgery, I didn't even have any family member around, but I didn't even feel like I didn't have anyone around. I was well taken care of, and I enjoyed the meals as well.
Before every surgery, we conduct a pre-procedure meeting. This meeting, all stakeholders involved in the care of patients, which includes the pharmacy, the doctors, the nurses, the procurement, the facility officers, they all sit together and discuss what is needed for this procedure to be successful.
What we do here is best practice. So it's the best practice in the world, or current standards, current guidelines. We practice based on the current guidelines. We also review our practices yearly to make sure that everything we're doing is current and updated.
When we want to do any procedures, we have guidelines that emphasize that things are done very safe and efficiently. For example, if a patient is coming into the hospital for any kind of procedure, we first do something called pre-assessment. So they come prior a few weeks before the procedure, where we run a lot of tests and investigation to ensure that there's nothing missing that we haven't picked, and try to rectify any abnormality that we might see.
We also do pediatric surgeries. We have a visiting pediatric surgeon who comes in to handle our pediatric surgeries. We also coordinate orthopedic clinics here. We also have an orthopedic surgeon who comes in to see our children with minor and indeed major limb issues. So we run a whole gamut of services here under pediatrics. So it's not just me, the pediatrician, coordinating it, but we also have the orthopedic person coming in to see kids, and also the pediatric surgeon, as the case may be.
People sometimes think that we're purely a fibroid clinic or center, but we do more than that. We see a lot of women, and we've done a lot of surgeries in the last few years with good outcomes. We deliver babies as well. We deliver a lot of babies. And we also offer pediatric surgery. Most recently, we're starting to collaborate with some partners in the UK, where the services that were not offered are seen by a lot of very specialized UK doctors, and they co-manage patients and hopefully do surgeries here. We're very excited about that, and using very experienced and very well-trained doctors within our facility. And that has started yielding fruit as well, especially from our breast care point of view, where we have engaged breast specialists from London who, through the emergence of telemedicine, see some patients over the virtual space and then come here to clinically appraise them and also operate on these women.
Core values of the laboratory, which are accuracy, precision, timeliness of results, and authenticity of results. Our results are highly efficient and accurate.
For us, patients' confidentiality and privacy is key. So we don't share our patients' information unless they've given us permission to do so. When we're doing our consultations, we make sure that it's just the doctor and the chaperone who is there. If there's anybody who needs to be in the consulting room as well, we take permission from the patients before the person can come in. So for us, privacy and confidentiality is one of the utmost things that we practice here.
Like I said as well, the surgeries are also done by extremely well-trained specialists. We're very, very particular about our outcomes. We also ensure that our specialists and nurses, all our staff have training. They keep on having updates in training to continue to improve them, to continue to make them aware of new ways or newer ways of doing things and newer technology. And that's our mantra, really.
We believe that the most important resource South Shore has is its people. Without a skilled workforce, there is no South Shore. Our values are demonstrated in our daily operations and communications, both internally and externally. Even when we recruit candidates, we use our interview process to determine those who have similar values, which means we hire based on values.
After your appointment, we send you a follow-up appointment date if required, and you can always give us a call for further inquiries.
Clinical governance is a department that ensures that high quality of service and care is being provided to our patients. Part of the things we do includes facilitating trainings, reviewing standards of operations, and creating new ones. Investigating incidents, conduct a root cause analysis to ensure that lessons are learned and corrections are also taken, and measures are put in place to prevent these incidents from reoccurring.
We are very strong on quality, and we're also very strong on customer care. Hence the establishment of a department called Clinical Governance Department, which always ensure that we do things the right way, and if that also involves a lot of training, and that also shows how committed we are to that. Hence the involvement of a quality assurance firm to come and assess us and offer us advice on how to continue to improve things.
On the 17th of May 2021, a safe care quality expert came into our facility to inspect our facility. This inspection covered a full range of clinical and management functions as well as infrastructural services. This assessment was very detailed and holistic. It cuts across different services that we provide here in South Shore. After the assessment was done, we waited for about 4 weeks to receive our report. And when our report came in, we couldn't be more proud of our achievements. After an assessment by SafeCare, a facility can either score anywhere between 0 and 100. And we're very proud to have a score which placed us in a level 4 certificate. To bring this to context, the average score of facilities in SafeCare program currently in Nigeria is 43. And we're actually very proud that at our first assessment, we were able to attain the level 4 certificate. The next thing for us now is to work on the quality improvement plan, and our aim is to eventually attain a level 5 certificate. This doesn't stop there. We'll keep perfecting our services, working on our standards of operations, and ensuring that we remain at the top.
I think we're very excited about the future because it gives us an opportunity to continue to improve ourselves, growth. We have a lot of plans in terms of women's health. We hopefully will continue to strengthen the service we offer. And that also goes to the fact that we have a sister company called Bloom Fertility, who offers assisted reproduction, things like IVF for fertility patients. We sincerely hope that we will reach out for an international accreditation in the next 1 or 2 years, just to continue to affirm our belief that we offer good quality care within the Nigerian space.
What to expect
at South Shore
Women's and Children's
Hospital.
And nothing less.
South Shore TV.